Yes, go ahead.
Okay. So we're going to start about the competences that we're going to come across the OSCE exam. So first of all, there is an ethical. I believe before we start, I believe most of you guys passed the MCQ exam, right? Like the majority of you like passed the MCQ exam. So pretty much the same modules, but the here in the OSCE they're gonna focus more on the communication. So again, they're gonna examine you on the ethical and legal and professional responsibility regarding how you're gonna deal with narcotics, how this stuff, patient care for sure, which is a therapeutic part. It's a 42%. So if you're not good in therapeutics, so that's going to be a little bit tough to pass this exam. So still, they will examine you in the patient care part, product distribution, and which is mainly non-interactive. If you remember the MCQ, they test this module in calculation part, but in the OSCE, it's pretty much not, there is no calculation. However, I believe they come across like in the last year or 2 years, one or two stations as of calculation. I'm not sure, but here in they focus on the non-interactive. So if someone has any kind of experience in a pharmacy in Canada or something like that, it's going to be very easy for him to go through this non-interactive. However, we're gonna we're gonna have some other stations to practice for everybody. Practice stations, practice setting, and there's not assessed in the OSCE practice setting. Scroll down, Mohammed, please. Health promotion. Health promotion is are the cases actually that they're going to ask about the vaccine, consultation on smoking cessation, stuff like that. Okay. If there is no direct health promotion in the exam, so it is going to be part of other stations. Let's say, for example, if you didn't come across in the exam come across like a station calling for like consultation for example, like smoking cessation or direct consultation for vaccine. So you're gonna find within the other stations that you should recommend for vaccines. For example, an autoimmune patient, a pregnant patient. Um, so if you do not recommend for vaccinate at the end of this kind of stations, you're losing the mark for healthcare promotion. Okay, health promotion. So can you scroll down? Knowledge and research application. It's I believe it's your capability to go through on the scroll like scroll through the um, maybe the studies you maybe or the references that you're going to be provided in the exam. So if you're not able to use this kind of references, that mean that or at least explain what's inside it. So that's going to be a big loss in this kind of uh, module. Communication and education. Communication is the main role play here in OSCE. It's not. I know it says like here 14%, but I believe um, it's more than that. I mean, education is like it's your ability to educate the patient or whoever candidate is or actor like you come across in the station. It's your ability to speak in lay language, either if the patient is coming to you is um, like a patient or something, or professional language, how to communicate your ideas in a professional way if you're coming across like a nurse or like a doctor or something like that. Okay, but in every in every module there is a communication with us. Like patient care, there's a communication. Like it's not all, it's not a written, it's not like a written exam. It's like, how do you gonna pass your ideas or your knowledge to whoever in front of you? Okay. Okay, quality and safety, which is 5%. It's your ability to maintain the workflow or provide a work environment and to promote safety towards the public. Okay, let's say, for example, if you come across a station that has that needs reconciliation for narcotics, stuff like that, how are you going to handle this? That's pretty much in the quality and safety. What else? Okay, that's pretty much the 9 modules that we're going to come across. With each module, there is a specific kind of sessions we will focus on. Let's say counseling for education, non-interactive for distribution. We are dedicating.
Hey, I have a question here. Like some of you guys usually is asking, do I have to check the reference even if I know like by heart the answer? This is an important or what? An important matter or what? Do you have to check really the reference during the OSCE exam or what? You need to do that? What do you think?
I think,
of course.
yeah.
Why you have to do that?
To get the mark of checking the reference, and also the information may change, so we have to double check it.
Okay, if I can answer this, Mohammed.
Yes, go ahead.
So I remember in my exam, some of the stations I didn't check the reference. However, I had a reference, but I was pretty sure, like I was really pretty sure from the answer, and I passed. So I don't think it is mandatory to check it. However, if you're gonna answer and you have the confidence in your answer and it is right, just do it, you know, because at the end of the game, it's like it's a communication exam, and you have a mentor and you have like someone like to check. It's gonna check your answers and give a feedback on your how do you answer and how do you communicate your ideas and stuff like that. So if you feel confident about something that you know about, just do it. That's my personal perspective about this point, and it happened with me personally. If you're hesitant, for sure that you should check your reference, no problem. But it's not something mandatory. Okay. Recently,
That's okay. Thank you. But Gazouly here, I have something to say here. So yes, for in your case, yes, it could be like it depends on the assessor by the way. Okay, but anyhow, I'm agree with the concept that we have to check the reference. Why? Because one of the competencies here is knowledge and research application, and it's granted about 6% of the scoring weight. Okay, this is number one. Number two, as one of the colleagues said, you have to make sure that you are updated, because the information usually may change from one time to another. Some recommendations, some updates from the manufacturer could be posted, and etc. Number three, with the abundance of the information that we have and the different references you may have in your practice setting. In your practice, you may have like 4 or 3 references. One of them, like for example, you want to know if the tablet that you have to, if the patient can take the tablet while like he may need to crash the tablet or swallow it like entirely as it is. You may have like 2 references here, and the two references may contradict one another. Okay, and it happens, by the way, in the practice setting. So this is the question: do you have to make sure that your information is updated, you have everything. You have to make sure that you can search for the information and apply the research tools or research application skill that you have, okay? And to be evaluated by that, you have to check the reference and find the important information that you're looking for, okay? So last thing, as I said, we have so many information now. We so many like medications are the like the medication that we have in the pharmacy are on the rise. Okay, it's not the same amount of medication that we have like 3 or 4 years ago. Okay, situation is changing and etc. So for me, checking the reference, I do recommend. Okay, I do strongly recommend to check the reference in your station, even if you know the knowledge, but you have here to make a very good time management. Okay, you have to. We will talk about that, about the checking, the reference checking, how much time you have to spend on the reference checking and etc. But this is very important thing for me. تفضل يا جدول. Go ahead.
Okay. So I believe we finished here talking about the modules. Does anyone have any question or anything regarding the modules?
Yeah,
Okay.
service thing, I think it's you should be aware of that. Okay, you have just to know that even by name, if you can recognize the competence, even by name. Here we go. So let's step into the SOS.
Okay. So the
Or-
SOS is actually it's a voluntarily scheme that we made, Mohammed and me, just to make sure that you're going through the right pathway through the station. Okay. So you can add up to you. You can dismiss for sure some of the questions. The main point here is we are trying to include everything. However, per station, as per every station, we are going to customize this SOS for each station. Okay. So we included pretty much everything, every question that may come across your mind. It's like a general kind of a scheme that we're going to use in the coming stations. Okay. So part one, which is the most important one, is the assessment of the patient who is coming to you, or the assessment of the situation. Okay. Let's say, for example, if you come across someone coming to you to ask for a repeat or a prescription for the first time. Mohammed, do you want to go through this, or you want me to follow up, to continue?
Yeah, you can go on.
Okay, so let's say, for example, for the first time, so you're in the pharmacy and you're coming across a patient who is coming to you asking for a prescription or a refill or something like that. The first thing to ask for is for whom this prescription for, or for whom this drug for. Whom are we asking for? Okay, you have to acknowledge your main candidate here. Okay. Is very important. Maybe you come across like a grandpa is asking for medication or a prescription for his granddaughter or something like this. If so, you have to ask for a consent. If you're coming across a patient asking for himself or for his dad, something like that. So the first important thing is you have to acknowledge the patient. That's number one. And then you have to review the patient profile. Okay, what is in the profile important as an information to ask for? The medical condition, allergy, if he has any medical condition. Let's say yes, he has a medical condition. He has like a blood pressure. If he mentioned any kind of medical condition, try to, as much as you can, to go deep through it to know what's going on. Let's say if he has diabetic, so is it diabetic type 1 or 2? Does it take, then is it controlled or not? Do you know the last readings? Okay, so then after you stop that, or does he have any other medical condition? Yes, blood pressure. Then what is the last reading? Does he have any other medical condition? No. And then you're going to go through the second step, asking about the prescription medication that he's taking. Yes, metformin. What's the strength? 500 milligram. How frequent? Two tablets 2 times a day. Okay. Amlodipine, 5 milligrams. Does he take it? Yes. How many times a day? One a day. Oh, he doesn't take it. He forget it. Okay. So we have to make sure and take notes. Then after that, what's the non-prescription medication, like over-the-counter medication? Any herbal or vitamins? Very important um, in some um, in some stations. Ask about the allergy. Ask about the type of allergy. Is it type 1 or 2? Rash, hives, anaphylactic shock. All those questions, we're going to give you a guidance to help you answer the question or under the concern. If there is a kind of a pain, so ask about the pain scale from 1 to 10, since one is the lowest, like 10 is the highest. Location, type, is it radiating or not? Where is it exactly? Okay. Pregnancy and breastfeeding, for sure, is a very important question if you're coming across like a female patient. Okay. The weight, sometimes it's a important question to ask. Some medication, for example, if you lose weight or if you gain weight, it's like it should change, right? If you're gonna prescribe something like Plan B, for example, it depends on the weight. It's gonna work or not. Pinworm medication, it's gonna, like, it depends on the weight as well, right? Profession, like let's say you're coming across a patient, he's bringing a prescription with Percocet or hydromorphs, and and you dispense it to him, and he's a truck driver. He's gonna take it, feel dizzy, you know, have a crash. So it's very important to ask, what do you work? Okay, listen, this medication make you drowsy, for example, so be cautious. Okay, if the patient is exercising, eating habit, alcohol sometimes interact with lots of medication as well as caffeine, right? Smoking is very important in the question if you're coming across like a diabetic patient, for example, blood pressure, stuff like this, right? Check the red flags if you're coming across like an over-the-counter or minor ailment station. Let's say, for example, someone is coming to you is asking for a common cold medication, and he has no cough, no fever, nothing, just runny nose and watery eyes, you know. So and for example, and he has like some dizziness and has some constipation since like 2 months. All this, oh, so you cannot prescribe something, so you should refer. So all these red flags, I believe the minor ailment is one of the important the red flags is one of the important questions if you are gonna prescribe something, okay, specifically in minor ailments. Any other concern? So before you leave the patient and check your reference, you have to ask him, is there any other concern that should I address before I leave you to check my reference? If there is another concern, we usually there are two questions. There's like the 5-minute question and the original question that he ask you. So if there is another question, he hides, and you ask him this if there's any other concern before I check my references, he will shoot it to you, and then you're gonna save time to answer like both questions on the same while you're checking your reference. Okay. So that's pretty much the assessment. So
Yes.
we gathered all the questions to come up with the red flag or the DTP, the drug therapy problem, that it will help you to buy to build up the hypothesis that you're going to check the references for, you know. So that's if anyone have any concern or any question regarding the assessment or want to add any question, please like.
Yes, I would like to ask something here. So what actually we need to do here from the assessment? What we are looking for? Okay, what we need to do?
Mohammed, yeah, he raised his hand.
What?
Mohammed Hassan raised his hand.
Yes.
Yes.
Good
Yes.
evening, guys. And thank you so
Good
much
evening.
for the effort you have done. Okay, so the thing here is to answer your first question is like, why do we do the assessment? From what I understand is you're trying to reach the problem, because I believe this will take, who knows, like 40%, 50% of the whole time of the 7 minutes. This is one thing. Second thing is like you ask the question of if there is any question missing, and I wonder, should we add liver and kidney condition as a question? Should we add outpatient, inpatient as a question? Should we add what kind of consent do you have in hand as a question? Just like to be comprehensive when it comes to part one assessment, and like what kind of questions can you have in mind? What do you think?
Yes, yes, that's a good question, Mohammed. Okay, so actually, you asked about the consent, and you asked about the vitals. If there's any, do you have any clue about like the liver enzymes, the creatinine clearance? That's gonna be answered when you ask for the first question, for whom. So if you have like let's say a patient, and it's coming to you with, for example, ciprofloxacin, for example, and he said, okay, this medication is for my grandpa or for my dad, for whoever, then again, at this point, you're gonna, okay, do you have, and you're gonna dispense like an antibiotic, so you have to ask about this. So it's bringing another questions, when you ask about whom. Okay, let's say, for example, about you're coming across like amoxicillin suspension for a baby. I don't think this medication, once you acknowledge the patient, so again, you're gonna find, the answer for your question. The consent is very relevant if I'm coming to bring a prescription, to pick up a prescription for my daughter, for example. That's a very relevant question for sure. If the patient himself is not coming to you, so you have to ask about a consent for sure. So when you're going to find up this upcoming question that you ask it for, when you ask about the acknowledgement of the patient. You got my point?
Yes, 100%.
Yeah.
Yes.
By the way, we are not going to ask all these questions. This is, we put as much as we can, and you said one important thing in the beginning of your talk. You said it's gonna take 70% of the time. Actually, this assessment, by the end of this course, you will do it in 2 minutes, and that's it. So our success here to do the assessment in the first minute and a half or 2 minutes maximum. There is no station should take an assessment more than 2 minutes, by the way. And there is no station in OSCE. Every OSCE station, every station is assigned to be finished and completely solve it in 7 minutes. Okay? If something wrong, so that means that you are doing something wrong. There is nothing wrong in the station. Okay?
Yes. Most important to know, the bulk of the information lies in this part. Okay, the most important information is here in this part. And it's not about questioning. It's not about asking questions. It's about asking relevant questions.
Exactly, yes.
Okay, you don't have to do, this is not like an exclusive list of all the questions that you have to ask. Not at all. Okay, but you have to choose. You have to filter what important information you are looking for. Okay, so if you are about like you can ask about the weight for something like the emergency contraception, for example. Yes, you can ask about the weight. If the medication has nothing to do with the weight, why would you like to ask about the weight? Okay.
Would you allow me to ask one more question, please?
Yes.
Yeah.
Okay. Can you please take us through the journey of like the 7 minutes? How does it look like literally? Like
it will come in the, don't worry, we will do it like soon. Don't worry. Let's discuss one part at a time, and then definitely you would know. No problem. Yeah, for sure. See, Mohammed says here, take 1 or 2 minutes to review your assessment, check references, prepare for counseling. Okay?
Yes. So the last question here is very important. You have to ask the patient or the actor in front of you this question. Do you have any other concern, any other information you would like to share with me? By asking this question, you killed any other concern. Okay? You killed any surprises at the end of your station. Okay, so this is like one of the most important questions. It's gonna save your time as well. Save your time at the end of the station. So what I would like to say here, guys, do not ask any questions. Don't waste your time asking about the eating habits and exercising if it's not relevant. If it's not relevant, do not ask about it. Okay? If you ask a relevant question, okay, you will be penalized for it. Okay? If you have an actor, a male actor in front of you, would it be relevant to ask him about the pregnancy, for example? Imagine the assessor, what would be what he's gonna do for you. Like if you ask any actor, a male actor about his pregnancy, are you pregnant or not? Is the assessor gonna let the issue pass like that, or you will be penalized? Okay, from my perspective, I'm pretty sure that you will be like deducted some marks for that, for asking irrelevant questions.
Yeah. On the other hand, if someone comes to you with thyroid medication, and if you didn't ask about multivitamin or iron, like over the counter, like or mineral vitamins, and let's say and he takes it at the same time with the thyroid, that's a big problem too, right? So you have to figure it out. What's the questions that you're gonna ask for? It depends on the situation. Okay.
Yes,
But here in like 90% of the stations here, like they shoot you the first question, and then you get lost in the assessment, and then you go for referencing, and then the 10-minute, like the 5-minute like peep like rings, and then he will shoot you another question, then you get confused. So that's why Mohammed is asking you to ask about, is there any concern from the beginning, to make sure that you go to the reference one time and get all you whatever like answers you need, and then you shoot it back to him. That's it. Okay. So you have to be like well organized. It's just a 7 minutes. 7 minutes sometimes with some station, it's not the like like it's not too long. I mean, okay.
Okay. So to wrap up in this part, what you need to do, you need to filter the important information from the bulk of the information. You have to be very selective here. What information you are looking for, pick them up, keep it aside, take your notes, check if there is any red flags, okay, to make your decision. What will be your decision? If you're gonna give like an over-the-counter medication, if you're gonna refer the patient, what type of referral you're gonna do, to the emergency, to the doctor, to whatever you're gonna do. Other thing, any other decisions that you would be making. If you're gonna prescribe medication, you're gonna change a medication, you send a recommendation to physician, and etc. Okay.
We have a question here, Mohammed. We have a question here. Does the actor ask the 5-minute question before going to check the reference? The 5-minute question is going to be asked once the 5-minute ring rings. Okay. Let's say, for example, if you are swamped with the station and you cannot really find the answer, or you're telling him like out of the box answer or whatever, So at the 5-minute when it rings, so the actor is meant to help you. So don't accuse the actor as if he's like against you. So he's here to help you. So he's gonna take you back to the main idea or the main question that he needs to be answered. Okay. So the actor is with you, so he helps you sometimes. And when and they are told when the 5-minute ring rings, it's he will shoot you the second question, and that's what he's meant for. That's it. Okay. When we check red flags in assessment part, I will let you know in the coming station. Don't worry. Do I write note about patient answering?
Red flag, usually you're asking about the red flag during
red flag assessment. Yes, maybe.
The patient has if the patient has diarrhea, you have to ask him, is there any other like symptoms with diarrhea, like fever or something? How many diarrhea are you doing? Is there any vomiting as well or not? All of these are red flags. So you are asking if patient comes in with a red eye. Is there any pains, any blurred vision? Is there like any headache, any loss of vision, all of these are red flags as well. So it's according to the symptoms.
Do I write notes about patient answerings? If you would like to write notes, yes, write notes. But I would love to make it two-way communication. Okay, so make it as a two-way communication as much as you can. Okay, but if you'd like to write notes, for sure, write notes. You will have a notebook and a pencil. So counseling. Okay, if you're counseling is a part of patient education. It's one of the main modules that we are coming across. Patient counseling. Okay, patient counseling is, and there is a specific um, non-DTP stations, like no drug therapy problem, just straight counseling. Consider no drug therapy problem. You have a medication, you're gonna counsel on it. Okay, so there's steps to counsel on any medication. Indication, the name of the product, the active ingredient. Okay, this medication is called Cepralex. It has escitalopram, 5 milligram for mood. It's a mood medication. Okay, you're gonna take it 1 tablet once a day. The duration of treatment, minimum 1 month. You're gonna feel improvement within the third week. Make sure that you're taking consistent. Positive outcome, help you on eating, help you on sleeping, safety and side effect management. Um, if you in the beginning of this treatment, you may some anxiousness, so that's normal. For example, if you're going to take any kind of NSAIDs like naproxen and Aleve or ibuprofen, make sure that you come to the pharmacy to ask questions, and it's better to take Tylenol because it may cause some stomach upset along with this escitalopram. Compliance, take it with or without food, take it every day.
نعم.
If you miss a dose, take it when
وين بابا؟
take it whenever you
بابا عم
remember.
يجيب اغراض.
معلش يا محمد if you can
Yes,
like
ايفون دكتورة معلش صوت صوتك شوية. اعمل ميوت. Okay. تمام. Go ahead.
Okay, so I give you an example on escitalopram for counseling. So that's you have to mention the indication, the efficacy, compliance. If there's any side effect, you can mention 1 or 2 side effects and how he should deal with them. Okay, for example, narcotic, you may come across constipation. You can take Senecot, drink lots of water. Some dizziness and drowsiness, don't take it if you're doing something need alert. Simple. Okay. Counseling pretty much is a double weapon station, easy to handle, but if you cannot communicate it properly, that come backfire to you. Okay. Anyone want to add something in the counseling?
Counseling here means sharing your decision that you made. What decision are you gonna do? If it's like a new medication and you verified the file and everything is okay, the patient can take the medication. This moment you have to go through the typical or systemic counseling, as we say. The indication, the name of the product. This is like the Crestor. You have been prescribed Crestor. Crestor contains a molecule called rosuvastatin. It works by that and that. You shouldn't feel any like improvement in your general health or something. This type of medication does not give any like instant effect or something, but it may protect your heart and etc. The way it works in very few words, in very abbreviated way. Then the side effect, what type of side effect it could happen, and if any side effect happens, should we do anything about it or no? Okay, and the compliance, how many tablets per day, at what time, with or without food, and etc. Okay, this is like a typical way of counseling. Okay, this is for new medications. You have to mention the 4 parts. If it's like not a new medication, you have to share the decision that you made. What type of decision you made? You have to see your doctor, you have to go to the emergency room, you have to stop the medication for now, you have to whenever the double the dose, reduce the dose, whatever, what decision you made. Okay, I'm gonna fax your doctor everything. Here is the counseling part. This is your answer. Okay, so first part, you gather information, you filter them, and you make your decision. Okay, here you share the decision. Third part is to follow up with your decision. It's very, very important to follow up. Okay, as I have always been saying, your role as a pharmacist, okay, are focused or concentrated in four main things. Okay, what I called escape F. What is escape F? Escape is ESCF. Okay, escape F. E is for effectiveness, the effectiveness of medication. You as a pharmacist, you have to make sure the medication is the effective one, it's the right one. Okay. Second thing is security, or like the safety of the medication. You have to make sure the medication does not cause any like annoying or bothersome side effects. And if there's any way that you can alleviate the side effect, or just make it like well tolerated. Okay, this is number one, safety of the medication. Number three, the C is for compliance. Okay, you have to follow up at every refill time that the patient's taking the medication as it should be. Okay, you have to take it with food, without food, and etc. Morning, evening, and etc. For how long as well. Okay, for how long you have to you keep taking the medication. Is it only for 6 days, for 1 week, for 2 years? Okay, for the duration of treatment. Last thing, the F is the follow-up. At every visit, as I said, you have to follow up with the patient. Okay, you have to follow up on what? On safety, efficacy, compliance. This is your role here in the healthcare system of Canada. Okay, to make sure the medication is effective, safe, and the patient is compliant. To do all of this, it will be like you have to make the follow-up at every visit. And these four competencies, these four rules that you have, they should be present in front of you while you are in front of the actor and beside the assessor in the OSCE station. Okay, you are here to make the medication effective, safe, and tolerable for the patient, and the patient, to make sure that the patient can take the medication every day, and that you are not like your relation with the patient does not come to the end with dispensing the medication. No, you have to follow up. Okay, that's it. You are a decision maker here, whether to dispense or not. Okay, you are, as we say, usually the famous saying that we say, the pharmacist is the expert of the drug, or the medication expert. Yes, you are. Okay, do not bother yourself with the diagnosis and the whatever related to the physician work. Okay, what comes to your role as a pharmacist is the medication, not the diagnosis. Okay, so don't bother yourself with the diagnosis. Don't repeat yourself. If the patient comes with a prescription with a certain diagnosis, do not ask about the symptoms. Do you feel that, or do you feel that? Or if a patient comes in with like pyelonephritis, do not bother your time. Do not waste your time asking about, do you have like flank pain? Do you have fever or something? It's not your job. Okay, so when it's prescribed for pyelonephritis, it is pyelonephritis. Okay, that's it. This is what we have to say here, guys, and all what we have. We have 3 simplified steps. Assessment, the bulk of the information, as I said, lies here. Okay, ask only relevant questions. Do not ask like million questions for nothing. Make sure that the red flags here, what is the job of red flags? Red flags is the paved way for your decision. Checking for red flags, you are paving the way for the decision. Okay, if the patient has red flag, that's it, you found it. You have to go to the doctor. You have to go to the emergency. If no red flags, so what's next? What I have to do? Can I give you an over-the-counter medication? They are taking any other medication with that can interact, for example, with this over-the-counter medication, and etc. Okay, so checking for red flags, killing any other concern, killing any other surprises by asking this question. By the way, the 5-minute question is not like it doesn't come every day on the OSCE exam, okay? It's been a while that I think there is no more 5-minute questions. It's only one concern. In the most of the cases, I believe there is only one concern now. Certain cases you may have like 2 concern or something. I don't know, but it's like 5-minute questions like old school. It's not relevant anymore. So, but just make sure, okay, you have to expect the unexpected on the OSCE. Expect the unexpected. So ask it to avoid any surprises. Ask the red flags to pave your way. Ask relevant questions. That's it. After you gather your information, take your time, review your assessment, filter the information, check the reference, and then shoot, as we say. Okay, load your gun, then shoot. Here is the shooting phase. Okay. Follow-up is very important in one word. Follow-up does not take more than 5 seconds. I'm gonna call you next week to check on the effectiveness of the medication, to check if you are suffering from any side effect or anything I can do for you. Anything. I will call you in 1 week, I'll call you in 3 days, and etc. And that's it. Okay. So, any questions? Gazouly, would you like to add anything?
No, regarding just one point regarding the follow-up, if you're going to follow up with for 2 things like the efficacy and side effect, give reasonable period of time. So if you're checking for example, a blood pressure medication or diabetes medication, you're not gonna check for the efficacy next day, right? You're going to check after maybe a month when she brings the A1C down or something like that, or meets the target of the blood pressure that's meant to be. If you're asking about a side effect, maybe in 2 or 3 days. For example, if we're going through a patient got some constipation from a narcotic, maybe in the 2nd or the 3rd day, some stomach upset from iron, you dispense an over the counter, maybe the 2nd or the 3rd day. So make it relevant, okay? Follow up for OTC is important, yes. If you're going to dispense anything, you have to follow up for it. Okay, take it a rule. If you're dispensing any medication, you have to counsel on it and you have to follow up on it. Okay. You cannot give him something over the counter and let him go without even counseling or follow up. Okay.
So mostly can I speak or unmute myself and speak, or I have to write the message?
Please, yes, go ahead, Jen.
Okay, so suppose normally the OTC, when we are recommending, mostly they are not our customer, right? So when we recommend a product, so at the same time we have to ask for the number as well to follow up with them.
If you recommend a product, so you
Yes.
have to counsel on it first.
Yes.
Okay, and then you have to follow up on it.
Yeah, but my question is that normally they are not our customer, right? They are not our patient. Then we do not have their file. So my question is, yeah, I understand the counseling part, but for the following, I have to follow up with you. So how I will follow up with you if I don't have your file with me?
If you don't have his file, what do you mean by don't have his file?
I suppose there's a customer come to the pharmacy, right? He did this first time he coming to the pharmacy, and he just looking for a product for runny nose. And we did all the assessment, we did everything, and after that we recommend a product, right?
Yes.
And we did counseling part as well.
Can I follow up? Just an act. Just tell him, can I follow up with you like in the next 2 to 3 days to make sure that you're not experiencing side effect? next week to make sure that, let's say, for example, you give Flonase or something behind the counter.
Yes.
Ask him that can I follow up with you like in a week or so to make sure that your symptoms are like weaned off or something like this. Just for the mentor to check that you followed up. That's it.
Okay. Thank you. Thank you so much.
Any question for the SOS, the scheme? How we can show empathy? Okay, it's a matter of Mariam. Have you ever worked in a pharmacy in Canada? No, you failed once. Okay. Any good expression or sentence? Okay, so it's a good question, and we will practice empathy. There is a big difference between empathy and sympathy. Okay, so empathy, you have to speak up about your feelings towards the situation, plus you have to be proactive. Okay, so both together, that's empathy. So you have to show, let's say, for example, an actor like approaching you in a sad face, and may I ask what concerns you, sir? Okay. Um, Oh, I'm really sorry to hear that. I'm really sorry to hear that. It's like it's when something big happens. Let's say someone telling you that I just got diagnosed with diabetes. That's a big thing. I just got diagnosed with cancer. My doctor found out that I'm a blood pressure patient. That's okay. I'm so sorry to hear that. I'll make sure that together we're gonna put like kind of a plan to make sure, along with the medication, to make sure that you're going through this in a positive way, for example. So you showed or you spoke up about your feeling towards the situation that's going on, plus you're helping the patient to come across this. That's what's called empathy. Okay, it's really hard for you. It must be bothering you if he's like this guy coming across, like, let's say, for example, a really hard symptoms of runny nose or allergy. You cannot tell him, I'm so sorry to hear that. That's out of the box expression. But you can tell him, oh, it maybe it's like really bothersome, something like this. Can we show empathy to patient with HIV or depression? Yes, for sure. You can show empathy with whoever you can. Um, yes, you definitely you can. What we supposed to do in case of someone said just go pregnant? Exactly. Okay, so is it okay? Someone's I just got pregnant. Okay, so is it planned pregnancy or no? Um, she may say yes, so that's congratulations because that's planned. The other scenario, no. How do you feel about it? She may be happy about it. She said, okay, congratulations. Oh, I feel like I'm not comfortable with it. I'm like, yeah, I can see that. Okay, so all this is expressions that will work. Okay, so pregnancy, not usually a happy thing. Sometimes it's not planned. Sometimes it's like, maybe from a rape. Okay, that's a bad thing then. So you have to ask, how do you feel about it? So it's a communication between two human beings. So you have to make sure that he express his feelings, so you absorb it and you express your feeling as well. If you do this, that's a good communication style, and you will be acknowledged in the OSCE exam. Okay, so it's not like it's not a robotic thing. It's like a communication way of like a two-way communication. I mean. Can we show empathy to patient with HIV? Yes, or depression? Yes. Yeah, depressed person. Everybody's depressed now, right? So it must be really tough for you. Um, we're all in the same boat. I understand that, all this. Okay. For HIV patient, how to acknowledge this? That's a tough one, actually. um, I I have one HIV patient in the pharmacy, and um, I don't know. Sometimes I've never shown empathy, but you may show a body language that you feel like you're like kind of sad or something. So because we are practicing over like an internet, so we don't have the chance to see each other's like face reaction and stuff. However, in the exam or the mock exam, we usually prefer to do like to open the camera because it's one of the marked. It's a way of communication to body language, right? So we usually do that in the mock exam. So yeah, someone come to you, told you that he got diagnosed with HIV. You're not gonna laugh or smile for sure. If you do that, that's a big no. Okay. A lady coming to you crying with like misoprostol because she's like she lost her baby. If you smile, and I know some people smiled and they lost it, you know. So just be logical. Yes, before congratulation, here we have to make sure she wants to get pregnant. Exactly. Yes, some people get pregnant because of like she got raped. So that's not gonna be a happy memory. Okay. Anyways, so all this examples for empathy. Okay. So let's see. هنشوف هتنفع ولا لا. If one station is failed, is it OSCE failed? It depends. Is it failed like you killed the patient? It doesn't work that way. Okay, so if you killed some patients in this OSCE station, that means that you're not safe to practice in Canada. So you have to get another chance. Okay, if it's like semi completed or something like this, it depends on the curve, on how we're going to react towards the rest of the stations. Try to focus on how to improve your practice in the stations, and don't focus about how to pass and fail. So just improve your performance, and you will pass, inshallah. تمام. So that's station 1. So anyone want to practice with Mohammed?
I want to ask one thing, please,
Yes.
regarding the 7 minutes. Yeah, regarding the 7 minutes journey. Can you take us through the 7 minute journey, please? Like,
So
how
the
does it look
first,
like
the
physically?
assessment part, yes, for sure. So the assessment part should take you no more than 2 minutes. If 1.5 minutes or something, so you are saving much time to check your reference, which is going to be better. So checking references should be between 2 and 3 minutes, and then you have to shoot the rest of the information in 2 minutes. So is that a good
So,
plan?
yeah, so like first things first. So you'll have like 30 seconds to read the door note, number 1. You'll hear
The door note is not
doorbell
counted, I believe, in the exam.
in the 7 minutes. Perfect. Okay,
Yeah,
so
it's not
30
counted.
seconds.
You have like not 30 seconds actually. It's like anyway. So let's say you have a 30-second in the door note,
Okay.
and then you get into by yourself into the station room. They're gonna leave you like
Mm.
20 seconds to read the patient profile and stuff like that. So prepare yourself.
Okay.
Okay. So after this, you're gonna have an idea of what's happening. Okay. So then they will come across the actor, assessment 2 minute. Okay, make sure that you're asking the relevant questions, and then after that you'll have a lot of time. Like if you check, for example, side effect, interaction, stuff like that, indication, that shouldn't take more than like 2 to 3 minutes. Okay, and then you'll have like another two minutes or something, like so you can say whatever you want. 2 minutes talking is a lot, by the way, if you know what you're going to talk about. Okay.
Okay. And then you will have a second bell that's ringing at the 5th minute, I believe.
Sorry?
You have a second doorbell that's ringing at the 5th minute.
At the 5th minute, they do this. They have they do this because some people like as if like they push people,
Milestone.
to wrap up everything. If you're not, things are, so.
Okay. Yeah, like a wake-up call.
100%, yes. Some people like lose the time. That's true. That's true.
Okay. Thank you.
Yeah.
Okay. very good. Okay, جازولي
One
معلش
last
اشرح
question.
الحتة دي. ماشي، بعد السؤال ده اشرح بس الستيشن احنا بنعملها براكتس ازاي. مرة والمرة التانية وخلاص على كده يعني.
طب maximum time for reference check احنا قلناها. If door note says there is no DRP, do we still need to check DDI? No. Don't check it. Okay. طيب for every station there's like 30 seconds we provide to check the patient profile. Okay. And then you will go through the station and then if it went through properly, we're gonna give you like a mark. If it didn't go through properly with the first candidate, we're gonna have another chance with another candidate, and then we're gonna discuss and let the fight begin. Okay. So Sarah and Lana, so they want to participate, I believe. ماشي. Sarah first, then Lana second. No problem. First
Okay,
session.
I'll try my best.
No problem. Okay. Mohamed, can you do this, please?
Yes, you want to do it?
No, you do it.
Okay, no problem. Do you have like a? We want somebody to watch the time, please, guys. Can you do it? جازولي ممكن تعملها؟ watch the time.
محمد ينفع تمسك محمد حسن ممكن تمسك التايمينج بليز؟
Sure.
معلش انا اسف عشان مش معايا تايمينج.
Yeah. You're gonna grant us 7 minutes. At 5 minutes, when it comes to 5 minutes, just alert us, okay?
Just tell us 5 minutes. Yeah. 2 minutes left. Okay. Tell us 2 minutes.
Before, yeah. Just yeah. That's يعني 2 minutes remaining. That's it. Okay.
Okay.
Okay. So are you guys on the WhatsApp or on the Telegram group? I think, right?
Telegram.
Okay. Very good. I'm gonna send you the reference here on the Telegram group.
Okay.
This is what? Yeah. Here we go. This is first. Station number 1 reference. You should have this one. Drugs used to treat COPD.
So you send it. Okay,
WhatsApp,
I got.
Telegram group. This is your reference for this station.
Okay.
Okay.
Mhm.
Very good. You found it?
Yeah, I found it.
Okay. Because this is like a virtual setting, so you will be granted 30 seconds before we start. Okay. So Mohamed Hassan, 30 seconds. We will start. Just say start. We're gonna start the discussion right away. Okay. So Sarah, you have 30 seconds now to check the reference quickly. Then
Okay. Okay. The 30 seconds to check the reference.
Yes.
Okay.
Okay, start.
Okay. Yes. Hi. My name is Jennifer. I'm like I'm the caregiver of Mr. Jeffrey Brown. He has a file here, and I have a new prescription for him.
Okay, Jennifer. I'm Sarah. I'm the pharmacist on duty today. Please have a seat. Can I know what brought you to the pharmacy today? You said you have a patient and he have a profile in our pharmacy, right?
Yes. Exactly.
Okay, and this is for okay. Patient name is Jeffrey
As
Brown.
I said, Jeffrey Brown. Yes, exactly.
Okay. and he's 73 years old. And what's wrong with Jeffrey, please?
Nothing wrong. I have a new prescription for him. I would like to refill it.
I want to fill it. Okay. Okay, and do you know why this prescription is for? Which condition?
Yes,
Or
it's
what?
for
Mhm.
acute exacerbation of his disease, COPD, I think.
Oh, that must be hard for Jeffrey.
Mhm.
I'm so sorry to hear that. I will try my best to help him.
No problem. He's used to it.
Okay. And apart from this condition, does Jeffrey have any other medical condition?
I think he has her file here at your pharmacy, guys. You can check it.
Okay. And he's using Tudraza and yeah, 2 buffers, right?
Tudorza, yes. You mean
And
Tudorza? Yes. Yeah.
Tudorza.
He's supposed to take 2, but he never does.
Oh, he's not compliant to his medication. That's why he got the exacerbation.
Maybe, yes, I believe. As I said, it's not like the first time he got the exacerbation.
Okay. And when did he get his exacerbation?
Yesterday.
Yesterday. Okay. Can I go back to the prescription, please? Okay, and he don't have any other medical condition other than the COPD, right?
He's taken a pill for his like depression or something. He has he has some like psychiatric problems.
Okay. And does he have any allergy?
No.
Okay. Does he use any other thing over the counter or something?
No, multivitamins. I believe.
Multivitamin. Okay. What about his vaccination?
He never get a vaccine.
Oh, I would recommend to get his to keep his vaccines up to date as he is a COPD patient.
Yes.
Okay.
What type of vaccines?
Okay. His flu vaccine and pneumococcal vaccine.
Okay.
And okay, can I the prescription have the prednisolone and amoxicillin? And does he get other than he's not compliant to his medication? Does anything else exacerbate his medical condition?
2 minutes left.
I'm not aware
2
of
minutes
that.
left.
I'm not aware of that.
Okay, just let me check my reference and I will get back to you.
Sure, no problem. Thank you.
Can I go back to the medication? Okay, I'll prescribe this medication for I'll give I'll fill this medication for Jeffrey.
Yes, very good. Thank you so much.
Yeah, and the doctor prescribed him amoxiclav, 1 tablet twice daily for 10 days. And this medication have some side effect. For example, like tummy upset. If he experienced that, he can take it with food, because the medication can be taken with or without food.
What do you mean by the upset?
Time's up.
Thumbs up.
Time's up. Okay, yeah. I think
Very
I
good,
felt this
Sarah.
sensation. I
Okay.
didn't get the point behind it.
We will discuss it after the second candidate, my dear.
Okay.
Yes.
I wrote all the notes that I can,
Mhm.
and
Yeah.
I will send it in the chat. But we have to take another candidate.
Yeah. Okay.
Go ahead. Yes. Any other candidate? I think Iana or Lana. Sarah, would you please lower your hand so we can see the other colleagues who's.
Okay.
Yeah,
Lana?
thank you. Lana?
Please can move me to another candidate because I cannot check my reference now and answer the case.
Okay, Mohammed Hassan, do you want to do
Yes.
it?
Yeah, I may try, yes, please.
Okay.
Okay, nice. Gazouly, would you like to do the actor?
لا do it انت كمل.
Okay, so there is no 30 seconds. Please keep that. Okay, I'm gonna watch the time for myself. Here we go. جاهز يا محمد?
Oh, okay.
Okay, yes. My name is Jennifer. I'm a caregiver of Mr. Jeffrey Brown. He has a file here, and I have a new prescription for him.
Thank you for coming to our pharmacy, Jennifer. Please have a seat here in this private counseling area, and everything we'll discuss will be kept confidential about the patient Brown Jeffrey. May I know what is the age of Mr. Brown, please?
73.
Okay. I can see here some data from the prescription he has just received. He has prescribed prednisone 50 milligram for 5 days, once daily, and an antibiotic. What does it seem to be the problem here for Mr. Brown today?
Acute exacerbation of COPD.
Okay, he's out. I'm sorry. Please go ahead. COPD, you said?
Yes.
Okay. And he is an outpatient or inpatient?
He's outpatient now.
Perfect. So it seems to be like a chronic COPD, or is his first exacerbation?
Yeah, it's a chronic, but it's not the first time he got this exacerbation. He gets this usually.
Okay. Do you know any information about what kind of medications he's receiving besides those who are prescribed today?
Yeah, he has all the medication here at your pharmacy. You can go through
Okay.
the file.
Okay, seems like he's suffering a classical COPD that's receiving salbutamol, like Ventolin and actinium, and Flovent. Do you have like what kind of buffers he's using right now? Which one of the three?
According to my knowledge, he has been taking the Ventolin intensively since yesterday.
Okay.
For the other buffers, I don't think that he's taken them regularly.
Okay. Maybe except the aclidinium because it was dispensed like 12 days ago.
Which one?
The
Aclidinium?
aclidinium, that doser, yes.
Maybe, yeah. Maybe, I'm not sure.
Okay, and it seems like also he's suffering from a little bit of depression or mood and insomnia.
Yes, for the stress and something.
Okay. And like, Do you know if he's using these medications regularly or not?
What, or the medication, or you mean the aripiprazole?
Yeah,
Yeah,
aripiprazole.
I think so. I think so.
Okay. Okay. Have you any update about his allergies? Like
He has no
allergic
allergy.
to any medication?
No
No
allergy.
Okay. Any over-the-counter medications, herbals, or vitamins that you know of?
Multivitamins only.
Okay. And then when it comes like to these daily habits, I don't assume that he is a heavy smoker, is he?
He used to be.
Used to be, but quit?
Yes, he quit.
Okay, perfect. That's good for him, of course. And then any alcohol consumption?
No,
Okay. Any thing related to exercise? Is he able to do anything with this history?
not so much. No.
Yeah, I can imagine. So now I can see that the doctor prescribed for him prednisone to control his symptoms, especially for a short duration of 5 days, and then an antibiotic. I may need like a couple of minutes to check my reference. Is it okay for you?
Yes, yes. Go ahead.
Do you want to ask me any other question before I check this?
Yes, actually, he got like. I would like you to give me something as well for diarrhea. He's been like he has like a semi-liquid stool since yesterday as well. And if you have any a product for it, it would be fine.
I can help definitely. In your best judgment, is there any fever that
No, it's only diarrhea. It's only diarrhea. It
Okay.
happened. It happened like 2 or 3 times. That's it. Not so much.
Okay, you said it's only watery. Is there any abdominal pain associated?
No,
Okay, is there any vomiting of any kind?
no other thing.
Blood in the diarrhea?
No,
Okay, so it looks like a stomach bug of like short duration just yesterday. He ate something wrong, maybe?
no. I don't know. I'm not sure.
Okay. Did you measure his blood pressure because of these 3 times diarrhea in one day? Like is hypotensive of any kind?
No, his blood pressure is
Oh,
no. Okay.
is normal. Okay.
Yes.
So
2
I will
minutes remaining.
also
2 minutes remaining.
I will also help you with this. Just let me for a few seconds check the prescription that he received. Okay, so I can dispense for him the prednisone as prescribed by his doctor, 1 tablet for 5 days, the 50 milligram, of course. And as I told you, like this one will help to improve his lung function and oxygenation, of course, and reducing the frequent hospitalization that you were just talking about. For the antibiotic, he will use the amoxiclav as the dose prescribed by his physician, and the duration of treatment should be 5 to 7 days. So I can see the doctor here has prescribed it twice daily for 10 days. And I wonder if there is a special thing that the doctor is thinking about. So do you mind if I reach the doctor by phone just to make sure before I dispense the antibiotic, the amoxiclav?
Yes. What is the problem with the amoxiclav?
It's the duration thing that's 10 days, which is longer 3 days than what's usually prescribed for patients like Mr. Brown. So it should be 5 to 7 days indeed.
Okay, you can reach him.
Okay, so I will reach the doctor and for the diarrhea thing, it's mostly the gastrolyte will help fragile patients like Mr. Brown. And if the diarrhea starts to be that much bothering for him, we can give him anything to stop it, just like Imodium and these kind of medications that can help with the mild
Okay.
diarrhea that he's
Time is
suffering
up.
from.
Time is up. Okay. Okay, Mohammed Hassan. Thank you so much, my friend. Thank you, Sarah, for your time. Okay, so let's start with Sarah. Sarah, my problem with your, are you here?
Yeah.
Okay, so my problem with you was lack of organization. You're,
Exactly.
you weren't, yeah. You were not systematic at all. You didn't follow any system or scheme. Okay.
Yeah.
You ask some question like in random way. In the middle of the discussion, you ask about vaccination. You're checking the reference. I think you're supposed to check the reference or something, and then you ask about vaccination, and that's it. So there is no like system. You didn't ask about the. You asked it twice about the medical conditions, while you have the file here. Okay. I told you a very important point that the exacerbation, he used to have it. He used to have
Yeah.
acute exacerbation.
Definitely.
Okay. So it's very important information. This guy is like a frequent exacerbator. It means he got acute exacerbation from every now and then. Okay. What would be the problem here? The problem is in his lack of compliance to the medication.
Yeah.
Okay? This is very clear. And I asked you asked me about the medication, and I told you he doesn't. I don't believe that he's supposed to take the two doors twice daily, but he never did. Okay, and the same situation for the other bombs. He was prescribed 3 bombs, 3 buffers, plus the
Yeah.
Ventolin for like rescue medication. So he has 4 buffers. Okay, does that make sense?
That's a lot.
Yeah, it's a lot. Okay, it doesn't make sense.
But
Okay,
some of them are, yeah.
it's a lot. For
One is
70
65
days.
days.
Here, yes, last refill, check. Last refill 6 months ago.
Mhm.
6 months ago. This one is for 2 months ago. This one about 12 days. There's no regular refills for his medications. Okay, and salbutamol, he's taken that intensively since yesterday because of the exacerbation. Okay,
Yeah.
that's it. So the first problem is the incompliance of the patient. This is what we have to deal with. And as I said, I gave you both of you, some clues, some in indexes. Like he used to have the acute exacerbation. This is not the first time. You usually get this, and etc. Okay. So
Yeah.
for Sarah, please be a little bit systematic. I believe that you are still in the first few days or weeks of your practicing to the OSCE exam. This is my impression. It's not
Yeah.
so bad. So
I wrote I wrote my acronym, but yeah, to be honest, yeah, I was distracted and yeah, jumping from one point to another without being organized. And one of the things that make me very stressful, I checked the reference. I didn't get anything that helped me in this case from the
hey,
reference.
guys, the objective of the reference, why I gave you the reference here, I gave you the reference to check the combination buffers. Okay, we have to combine. There's only one buffer that combines 3 of those. Okay, combine the anticholinergic long-acting molecule and beta agonist, long-acting beta agonist, and the corticosteroid. You can check the trilogy. Trilogy, it combines 3 of those in only 1 buff per day. 1 puff per day. Okay? That's it. This is the solution. This is number 1. Number 2 is about the diarrhea. You didn't ask the question. Do you have any other concern?
Will make more diarrhea.
Yeah, this diarrhea. The guy is suffering from diarrhea, and he got prescribed amoxicillin, amoxiclav. Okay, so here you have to what you have to do here?
Change the antibiotic to amoxicillin only, or change the class.
Or what?
We'll change the class completely.
Why?
No,
Change
I
the
think
class of
even if we
amoxicillin.
change the class, he will get the diarrhea. something
Yes.
with all antibiotics. But we can advise the patient to drink more water, keep himself hydrated.
Probiotic, anything.
Probiotics.
Probiotics
Mhm.
2 hours after.
Probiotics, yes. Any, it's a
When should the
any
patient take the
antibiotic,
probiotic? What
any.
time? Sorry,
Does,
Gazouly. What time?
بص, Mohammed, honestly, do you think that it can be solved with all these problems lying in each and every corner in 7 minutes while checking
Yes,
reference?
it can.
The main
Definitely it can.
problem.
You know what? You know what? You didn't pick up the what he said. If you picked up what he said, you would know that's a compliance. He said
This is
two
what
times.
you assume.
He said two
This is what you
times,
assume
and
because you
for
are the one who
yourself, you
created
did
the
three
case.
times.
But
He's used
I'm
to
not
it.
100% sure everyone who's seeing this case for the first time
Guys,
will be able to
guys,
figure
Muhammad,
all
the
this
problem
together
here,
and check
the
the
main
reference
problem
in
here,
7
Muhammad
minutes.
ya
I'm
Hassan,
not sure.
Muhammad ya Hassan, Muhammad ya Hassan. The main problem here,
نمر الأسود.
the main problem here, the main problem
Yeah.
here is the incompliance. What's the main problem? The acute exacerbation, the frequent acute exacerbation. Originated from what problem? The patient is not taking his pumps, his buffers. Why? Because he's 73 years old. He has stress, he's stressed or depressed or something, I don't know. Okay. So what you have to do, it makes sense. You have a table in front of you with all the medication that could be prescribed for COPD. And you can find 3 different classes in 3 different buffers. Okay. With the least effort, you would solve it. What you have to do, we have to combine. We can give one buffer with 2 molecules, for example, with 2 drugs. Or 3 of them in one pump or on one buffer, for example. You have to combine here. You have to make the things very easy to him. 3 buffers with 3 different types. Like this one is gene wear. This is Tedrosa gene wear. This one is discus. This one is like the PMI. 3 different types. Okay.
Yeah. So
That's
this
it.
one needs someone who is aware about what things we have in the pharmacy, right?
No, it's aware of what you have in front of you. It says here Flovent, the last refill, 187. So he's not taking the corticosteroid, number 1.
Yeah.
The last thing, Serverant, okay, the beta blocker. He didn't take him properly, and he said, it's sometimes one word, it may affect the whole situation. For example, if you come across a patient, and I had this in my exam actually. She's taking thyroid medication. It's like, oh my god, and she said one sentence in the beginning of this. Oh my god, that's a lot of meds. I'm gonna forget it. And she didn't speak any other, and she didn't say any other thing. So you have to make sure that she's forgetful, and you're gonna do a blister pack. If you didn't pick it up, so you're lost. It's your problem.
Yeah. Yeah.
You know,
I
so you
know.
have to know what he's giving, like what he says. You have to actively listening. And Mohammed said it more than like 2 or 3 times. Even Jan
Yeah.
said, like he laughed at it. He said, "Oh, it's used to it." Yes, it has something to red flag. You know, it's a red
Yeah.
flag.
I
You
picked
know?
the non-compliance, but I don't know what to do in this.
Exactly.
So
So
okay.
that's a good question here. So that's a good question. So for compliance, you have to ask the doctor, why do you think he's not compliant for? Does he need any review on how to use it? Maybe he said
Okay.
yes. So okay, I'm
Why?
gonna call the patient. I'm gonna review it with them. Maybe he said no. He knows how to use it, but it's a lot of a lot of buffers. Okay, so I have an idea. Why not combine them all in one buffer? And it's done.
So you
You know,
will
you have
combine
to be
the 3
alert
of
of
them in
what's
one buffer.
given. Sorry, Mohammed.
You will combine 3 of them in one buffer, and then you'll keep salbutamol
As you
live
like,
and emergency
as you
buffers.
like. What you can do. You have the table here. One moment, my friend. Here you go. Here's the table. Okay, you have all the medication in Canada available for treatment of COPD. Okay, this is short-acting beta blocker, short-acting muscarinic. We don't need that. You have here combination of 2. No, we don't need that neither. So here, starting from here, long-acting bronchodilator. Okay, this is different types. And here you have the combination of both of them. The patient is taking LABA and LAMA. So you can combine, that's it. You solve one problem, the other problem would be the corticosteroid, which is Fluent. Okay? Right?
Mm.
That's it.
So one question in the assessment directed you to the problem here, right? Then you can spend a lot of time like searching your reference. But you guys got swamped in so many like relevant like for example, she said, I'm going to prescribe. You're not a prescriber, by the way. It says you have to say you're gonna dispense it. I'm not sure if you look into my commands. So for Sarah, she got confused because of she's not maybe the first time and she's not organized. That's fine. But she said like her language is a little bit different. So she said, okay, I'm gonna prescribe something. Okay. She didn't even listen. So the opening sentence, Mohammed said, okay, I'm here, a doctor. I'm asking about medication for my patient so and so. Then she repeated back, may I ask who's your patient? And he told her, yeah, I told you in the beginning. So what you're here for? So that's a loss of time, right? So
Yeah, yeah.
that's where we're trying. Yes, she has to actively listen and then cooperate.
You consider now both answers like partially solved because they didn't put the
For
patient in
you
danger,
as well,
or
Mohammed, for you, yes, Sarah is completely unsolved. Okay. For yourself, I would consider, yes, completely unsolved as well. Could you bother yourself with the prescription? Do you have any reference in front of you for the antibiotic prescription, for the duration of treatment or something?
the last page, yes.
What?
The last page in the same reference that you're holding now is talking about the duration of antibiotic treatment.
Here you go. The last page, you have a prescription for the antibiotic.
Yeah.
Where is it?
Go up a little bit more.
Exacerbation.
Okay, now
Duration of treatment is usually 7 to 8 days. One moment.
treatment principles.
principles.
Yeah, treatment principles combined with the systemic corticosteroid therapy, and then he's talking about prednisone, dose and duration, combined with antibiotic therapy.
One moment. Duration of treatment 7 to 10 days. Sheet of bronchitis, exacerbation. Okay, so this is point. No problem. But okay, this is usually.
ثواني. Give me 1 second. Mohammed, he's supposed to be the doctor. Mohamed Sayad, he is the doctor who prescribed it, right?
Yes.
Gamil. That's very nice. So in your answer, Mohammed Hassan, you told him that I'm going to contact the doctor who prescribed. Who is that?
I think okay. It's my bad understanding. I thought that I'm talking to
So you didn't know who are you talking about. Exactly. No, it's not your bad, my friend. It is you're lost because of you're not concentrating. You lost whom you're talking to. You are talking to the doctor himself.
My question is, the problem is, you said as well that I'm gonna check with the doctor first before I give you the medication or something, right? Okay, so for me, you can dispense the medication and then you can check. Then you can check for even 10 days treatment. It's not a problem, by the way. Even 10 days treatment is not a problem. You can see that in the practice as well. Okay, so this is like a big deal. The problem is if you give him like a short duration of treatment, of recommended treatment, you should treat it with 7 days and you give him only 5 days or 4 days.
I got your point.
This is the real problem. Then dispense the medication, give him even 7 days, and then you can provide the check with the doctor and you come back. Okay, so this, do not stop that, you have to dispense here. It's like acute exacerbation, the patient needs the medication. What if the doctor is not in the clinic? Okay. That's it.
Okay.
So yeah,
El
dispense, then
guidance-
check with the
guidance-
doctor.
Yeah, this guidance is prescription vigilance.
Yes.
Yeah.
Okay.
Thank you, guys. Yeah, I really appreciate it.
Okay. So compliance is one of your main tasks. Remember, escape F for ESCF. Effectiveness, safety, compliance, follow-up. What about vaccination? The good
Yes.
thing about
Sarah asked about vaccines.
vaccination.
I don't
Yes.
think Mohammed asked about vaccines.
No, he didn't. He didn't.
He did ask.
No, he didn't.
Yes, he didn't ask about vaccine. Sarah asked about vaccine.
No, I didn't.
I
Oh,
think
I did
even
not
though I
ask
did
about-
so bad, but I said that I will dispense, and yeah, I asked about the vaccine, but I was feeling myself lost.
Okay, so let's tell you something, Sarah, because you said you asked about the vaccine, but
Yeah.
yes, that's true, but it wasn't complete. So
Yeah,
a
I know.
COPD patient, it's we usually ask about like the flu shot and the pneumonia shot. Okay, so it's only one sentence. I just want to make sure that his vaccination are updated or up to date. He will say yes, that's good. If he say no, please, if I can contact the patient so I can update his vaccines. And as simple as that. And you got the mark for the health promotion. Mohammed, unfortunately, he forgot to ask about it.
Yeah, you're right. So your best like
But
the
Mohammed,
missing
I have
question is-
sorry, Mohammed, to interrupt you. Mohammed asked a very important thing. He asked about the smoking. Okay,
Yeah.
you didn't ask
Yeah.
about smoking. In COPD patient, it's better to ask about smoking direct and indirect. Does he smoke? No. Does he live with someone who smokes? That's important too. Okay.
Yeah, I met a passive COPD smoker, which was very strange, but this is true. Like a
Muslim,
female
Muhammad,
was smoking the-
Muhammad
we
didn't.
are practicing as much as we can. Sometimes you have things in mind, but you because if you're maybe stressed or something, your thoughts are chasing each other, so you forget it. And you think you asked about it. Okay.
No,
So
I'm telling you something. Probably now you are not listening to me. No, I'm telling you, I met physically a COPD negative smoker. So you are right when we should ask about negative smoking.
yes.
I met physically a patient who is COPD, never smoking in his life, was like negative smoker. You know what I mean? Like his parents was smokers and then was married to a smoker. You know what I mean?
Yeah.
So you can find really, you're right about this. You can find COPD patients who never smokes, like negative passive smoker, right? Very rare, but it happens.
Okay. So what
So,
about vitamin D?
we are on
Is
the-
it okay to ask the doctor? Yes, sure. Vitamin D is recommended. Recommended
I have a
start
question.
with age.
What is vitamin D is for?
For what age? At what age we start recommending vitamin D?
No, I'm asking here, hi. I'm asking here about vitamin D because I guess it's when it reaches a certain level, it can lead to exacerbation for COPD.
Vitamin D is important here. Okay. Based on
Yeah.
his age recommendation, his age is 3.
73, yes?
Usually we start recommending vitamin D to all Canadians starting 50. Okay, 50 years old. We recommend vitamin D with 800 unit usually, from 800 to 200 to 2000 unit daily. This is a recommendation of vitamin D at this age. And it's important as well for immunity, for the immunity side. For the acute frequent exacerbator, yes, it would be important as well.
So it's okay to ask the doctor.
Yeah, you can ask, or you can even recommend if you would like some vitamin D some vitamin D supplement.
Okay, thank you.
Okay, very good point. Thank you. This is like a bonus score. The vitamin D is like a bonus score, like the vaccination. If you ask about vaccination, yes, it's important. Okay, so let's go on.
Wait a second. There's a question. Does a caregiver equal his doctor? No. Healthcare provider is different from a caregiver. Caregiver, maybe someone, one of his relative, like daughter or stuff like that. Someone is taking care of him. PSW, personal support worker, can be a caregiver. Social worker can be a caregiver, but not a doctor, not a pharmacist. Okay.
Vitamin D can be recommended if the low
And Mohammed never said he's a caregiver. He is the healthcare provider. That's if you, Mohammed, please bring the station number one.
No, I said in the station I'm a caregiver.
You're okay, so that's my mistake then. So it says in the beginning, it's he's a healthcare provider. The
Caregiver.
beginning of the station.
Okay,
no
guys.
problem.
Thank you so much. I hope it's clear. The point is with you have to do your job here as a pharmacist. Okay. As I said, make sure that you have the 4 corners of your practice in front of you. Okay, the effectiveness, safety, compliance, and follow up with the patient. And ask relevant question, please. Okay. Station number 2. Let's step into station number 2. Want to participate? Liana or Lana?
Yes.
Yes, how are you? I sent you already the.
Yes. I hope this case not difficult like first one.
It's very simple one. You are Lebanese or what?
I am Syrian.
Syrian Lebanese. بتتكلموا زي بعض انتوا.
Yes.
طيب يلا
Okay.
بينا. Okay, are you ready? Ready?
Yes.
One moment, I'm gonna watch the time. ما تعمل معروف يا حسن وتشوف لنا الوقت يا محمد يا حسن.
من عينيا حبيبي.
تسلم يا باشا. تسلم. خلاص هنديها 30 ثانية وتقول لي ستارت وبعد كده قبل دقيقتين تقول لي. اوكي لنا or your name is
Lana, yes.
اوكي لنا وعلينا. يلا يا لنا.
Okay.
30 seconds. Go. Yes, start 30 ثانية. Okay.
Okay.
أبدأ.
نبدأ.
Yes.
Yes.
Hi.
I'm Lana. Hi, I'm Lana, the pharmacist here. How can I help you today?
Hi Lana,
Hi.
the pharmacist. It's me. انت يا ابني ولا انت؟
أنا.
ما
Yes.
تنوش يا عم استنى.
Sorry, أنا آسف. Sorry. Hi, my name is Richard. I'm here to pick up my medication. I just phoned you guys to pick up my 2 meds that are due.
So you are Richard and you are here to pick up your medication?
Yeah, medication, yes. Blood
Okay,
pressure
sure.
medication and prostate medication.
Okay, sure. I will help you with that. Please have a seat in our private counseling area. Everything we will discuss will be kept confidential. So Richard, do you mind if I ask you a few questions to assess you better?
Yeah, I have a question first. I'm here to pick up my silodizine. That's my prostate medication. And when I called, I have the pharmacist before you said that this medication is on back order. I don't know what to do.
Okay, sure. I will help you with that. So your prescription is silodocine?
Yes, I'm here to pick up telmisartan and silidocine. And my
Telmisartan
concern,
and silodocine. Okay.
yes, and my concern here is that medication is on back order. That's what I heard.
Okay, sure. I will help you with that. So may I know what the reason that you see the doctor recently, Richard?
I didn't see the doctor at all. I'm here to pick up my medication. And I
So
need my
this is just refill, yes?
refill, yes.
Yeah, okay. Okay, Richard, may I know what the medical condition that you have?
I have blood pressure and I have prostate medication that I need to pick up. I need this medication.
Okay. And do you have any allergies, Richard?
No change in the allergies. No, nothing.
Do you take any other prescription medication, any other samples?
Samples? I don't take any samples.
Okay. Do you take any over-the-counter, any herbal, any supplement?
I take aspirin, baby aspirin for protection. Hard to protect.
Okay. And regarding your lifestyle, I just want to ask you a few questions. Do you drink caffeinated beverage like coffee, tea, cola?
Sometimes I drink cola, yes.
Okay. And do you drink alcohol?
Yes,
How many cups per day?
once a week and the
Once a
weekend.
week. Okay. And do you smoke?
No.
Do you have time for exercise?
Sometimes I walk the dog every day or something.
Okay, that's good. And how do you describe your diet?
Actually, it's pretty good.
Good. Okay. Okay. May I know your weight also?
No,
Okay.
I
Okay.
don't
Thank
feel
you.
sharing my weight with you.
Okay. Thank you, Richard. Do you have any other concern for me?
I need my medication.
Okay. Just let me check my reference and I will come back to you shortly.
Okay.
So do you take all your medication regularly as prescribed? Do you take psilocybin as prescribed? I see here the last fill 65 days ago, and you should take one tablet once daily.
Yes,
So-
yes. I took last time it was 65. Yes, I take everything as prescribed, but I heard it's in a back order and I need this.
Okay, okay.
Is there any idea? So anything
No,
that
I
you
didn't see any about any information about back order in the reference.
it is back order. Back order means that the manufacturer is not gonna supply you guys for the coming month, and I need this medication. That's what's mean by back order. Is there
Yeah,
any?
but here there's no information about if, so I
telling
need to
I'm
fax the
telling
doctor
you
to change the medication for you.
what
1
medication?
minute.
Psilocybin. So if there is back order, so I didn't see any back order here in the reference.
The pharmacist before you told me that it's on back order. So I believe it's on back order. So how would you? What should I do?
So in this case, if this back order, so you need to check with your doctor if he can recommend for you another medication from the same group. So for treatment your benign prostatic hyperplasia.
And I believe you are the pharmacist. You can give your recommendation for this. What's your input?
I will fax the doctor about this issue and I will document that in the pharmacy and I will tell him that there is no medication or there is the company will not there's back
What-
order of this medication, so so he
Time.
can change the medication for you to another to another thing. And this
What medication you
Time.
recommend?
I will recommend for you like
Fine,
alpha-zocine or tamsulosin.
Okay, thank you so much. Guys, please, during the session, do not do recommendation. Just participate with us and give a chance for our, your colleague. Okay. Thank you, Lena. Thank you, Maria.
Thank you so much.
No problem. Okay. If someone else want to participate, Jan, Said, can you participate with us, please? John.
Hi. Hello, sir. Assalamu alaikum.
Salam. Who's that? Sorry.
Jan, sir.
Yes, Jan. Hi. How
This
are
is
you, my friend?
different.
Okay.
This
Sorry?
is, you're asking about me or Jan or John?
No, go ahead. Yeah, let's go. Anyone. Jan is good. Jan is good.
This is my
Okay.
first day.
No problem.
Okay.
Can Mohammed, please, Mohammed Hassan, if you don't mind, can you redo the
Sure.
timing? Thank you, my
Okay.
friend. أنا سمعتك. I know you did you did say like time is over so many times. أنا بس كنت عايزها يعني أي حاجة. معلش أنا آسف.
ما انا مش عايزه تزعل مني بس.
أنا عارف أنا. Let's start with Jan. Noha, okay, I'm sorry. Next time, do we have another station? Next time we will do it for you. No problem. ماشي.
Start immediately.
Sorry?
Start immediately.
We're gonna start immediately, Jen. Okay.
Okay, no problem.
Okay. Hi, my name is Richard, and I am here to pick up my medication. I called you guys before I come. I hope it's ready. But one of the medication, your previous pharmacist said it's on back order, something like this. I'm not sure.
Okay. Hi, my name is John. I'm the pharmacist on duty. For sure, I'm happy to help you. I need to ask a few questions before to assist you here. What's your name?
I'm Richard.
Richard, and date of birth, just to make sure that I pull up your file.
I have 53 years old.
Okay, so I can see on your file that you are taking telmisartan 440 milligram, one tablet once daily, that you filled 12 days ago, right?
Yeah.
Okay, and there's one other medication, saludocin 4 milligram tablet, one tablet once daily. You filled this medication 65 days ago, and are you still taking this medication, correct?
Mm-hmm.
Yeah, and there's a sildenafil, one tablet when needed 60 minutes before sexual related, and aspirin 81 milligram. There is any update on your allergy? Like,
no.
are you allergic to any medication?
No.
Okay. Do you have any adverse effect taking these medication? Oh, sorry, side effect?
For the medication, no. I need just urgently my prostate medication.
Okay, so you are looking for your prostate medication to fill it.
Yeah,
so may I know the reason why doctor discontinued tamsulosin?
Yeah, I used to take it in the beginning. It was very good. The results was amazing, but I felt a little bit dizzy. So he decided to switch it. You know what? It was doing good for me. So I don't know. He just said, if you feel dizzy, we can try another thing. And he put me on silidozine, and it's working too.
Okay, and how is your blood pressure reading?
Blood pressure?
Yes.
It was normal. Nothing
not.
to worry about.
So when you start that silidozine, you are not feeling any dizziness, right?
No, I don't feel any dizziness.
Okay. Okay, so as you said, like this medication is on back order, right? So I have to find an alternative. So
actually, I didn't say anything. Your pharmacist, your colleague said so.
Okay.
I need my medication actually.
Okay, so if it is not back order, I will just fill this medication for you. And okay, so it's not a back order. We have this medication, and I can fill this medication for you. And silidozin, that's for your prostate, right?
Your colleague said it's on back order.
Okay, so let's suppose it's back order. Okay, so Richard, this medication, Celodicin 4 milligram, it's on back order, but I can fax to your doctor. We have other alternatives. Are you okay with that to contact your
Yeah,
doctor?
it doesn't matter. It doesn't matter.
Yeah. Okay,
As
I will
long as
fix.
it's gonna do the job, doesn't matter.
Okay, and you still have enough stock at home. It looks like you filled this for 3 months, right?
No, I filled it for 65 days.
65 days. So you do not have any medication today,
Nothing.
right? To take it. Okay.
Nothing.
So I will fix to your doctor right away, and I will let you know as soon as I get the fix back from the doctor. And yeah, so I will fix to the doctor. I will give the recommendation for the alfuzosin.
What?
You have any?
What? What's you gonna give?
I will, I will ask because you already used tamsulosin, right? So you
Yes,
will
and
not.
that was good. Yes.
So I will ask for alfuzosin. Or yeah, I think that's what I would recommend to doctor. And then we do have other option as well, like the prazosin. But you're taking the other medication, right? Like blood pressure medication. So I think this alpha-leucin is relatively not causing more hypotension. So that's my recommendation. I hope I'm right or
So
wrong.
because I'm confused, I don't know what you said. So what are you gonna recommend for me? Because
I
you
will
said
fix it.
tamsulosin, then you said alpha-azosine, then you said brazosine. So which one are you gonna recommend? Because I need to know what you're gonna.
Alpha-zocin, I will recommend alpha-zocin. I will fax to the doctor that this we have a Celodicin is on back order, and I would recommend to
Azosine.
to change this patient to alpha-zocin.
Okay.
Is that
Okay.
right?
Is that I don't know. You're the one who's gonna tell me the advice. Is that
Okay.
right? So that's right. I don't know.
Okay, are you okay with that to contact your doctor?
Yes, definitely. I'm okay with anything as long as I'm gonna take prostate medication, for sure.
Okay, and may I know why you are taking aspirin?
For protection, heart
Or
protection.
you had a like myocardial infarction or
No,
heart
just
attack?
heart protection. Just heart protection.
Okay, so the doctor prescribed, the doctor told you that, or you're taking by
I
yourself?
got advised by a doctor to take it like once a day. Yes.
Okay, I will also ask this because if you do not have a um, like a heart attack or any cardiovascular heart issues, and you're just taking for, it's not recommended as well to take
I
81
believe
milligram.
I take it not to have a heart attack. So it's for protection, not for treatment.
Okay,
That's
and the
what I
doctor.
was told by doctor. Yes.
Okay, I think I'm done. So I already fixed to the doctor, and we'll wait to the we will wait for the effects, and then I will let you know.
Okay. Thank you so much.
Thanks.
Okay. Wow. Gonna give him new one and send to the doctor. Okay. Okay. Let me give you my my thoughts about this. Okay. So we have a medication here that is on back order and it's working for a patient. Okay. Back order means that it's not available, so you can dispense it for some reason. Okay, maybe it's a manufacturing problem, no need. So this is something that the actor is telling you, so we consider it a fact, and it does not be needed to be mentioned in the reference. Okay, so the reference will not tell you it's this medication on back order. Okay. So don't be stubborn with the actor because I'm giving you a right information. Okay, that's number one. Number two, I was in tamsulosin. It was working. Okay, very minimal side effect, dizziness. I'm gonna take it at night anyways, so no problem, right? So why you switch to another molecule? That's my question. Why you switch to another molecule?
Mostly orthostatic hypotension.
Who said that?
Me, Mohamed.
Okay, that's a very good option. Did you ask me about orthostatic hypotension?
No, I'm talking scientific, but he didn't ask.
Scientific. There is another scientific issue that no one mentioned at all. I'm taking Viagra.
Yeah, I was gonna say it.
Exactly. What's going to happen if I took Viagra and tamsulosin or alpha-zosylene or prazosin at the same time? What's going to happen? No one mentioned this DTG. It's going to be severe hypotension, right? So no one mentioned this DTP. It's very important. How you take your medication. You picked up like sildenafil 15 times, 15 days ago. How often do you take it? Did you take it today? Are you aware that you shouldn't be taking it with like the prostate medication? I would say yes or no. So then you kind of start from there. So you just concerned here. There's two DTPs actually. The first DTP, which was very obvious, because my regular medication was on back order. So everybody said, okay, I'm gonna fax your doctor. There's another option, tamsulosin, alpha-cysteine, whatever. Okay, but he didn't notice. I thought the other candidate who will, because he went through everything with me with the medication, so I thought he's gonna pick it up, but unfortunately he didn't. So sildenafil and a prostate medication, that's an hypertension. Okay, so that should be discussed with a patient as a matter of patient care. Okay, folks. Aspirin 81 is not a treatment. It's a secondary prevention, actually. So if someone taking it over the counter for protection, it's fine to be taken. It's fine. Okay.
But sir, I cannot see anything like here on his file that he has a heart issue in the past.
There's no heart issue. There is no heart issue at all.
So if you do not have a heart attack or something like that, right? Or
He just take it. He just take it for protection. That's it.
okay, like so that will be considered like a primary protection, and it's not recommended for primary protection, right?
And when he said it's not a primary protection. When he said, okay, there is Karen said he asked about your blood pressure. My blood pressure was good, but my blood pressure will be severely low if I took it together, right?
Yes.
So that's actually no one mentions, and that's a main DTP here in the patient. If someone,
bathroom,
Malish, can you please
flush it.
mute?
Sorry, can you address this aspirin 81 milligram problem as well?
Forget about the aspirin, my friend. Aspirin is an over-the-counter. That's not the issue here. You're focusing on the aspirin, and the aspirin is not the issue. I can stop the aspirin, no problem.
Okay, so here I have one more thing, sir. Like this guy, he's taking sildenafil.
Yes, go ahead.
This guy is taking sildenafil 100 milligram 15 days ago. So it's not a new prescription, right? That when he was taking that medication, by that time maybe the pharmacist explained to the patient that how to take this.
Why you assume? Give me one question. One answer? Why you assumed it? Why?
Okay, so I'm just trying to understand, like every time when we see the profile and there is something, we have to repeat that. Like in this case, even though you are here to refill your sildenafil, but we have to check the file if we can see anything like here, as you said, like sildenafil, we have to address that too, right?
Okay, so let's have a rule of thumb here. So a refill, consider a refill as if it's the first time. Okay, specifically, you are going to dispense another medication. Here, you're gonna stop there is no repeat here, right? There is no refill for sildenafil. You're going to give alpha-cysteine, right? So that's a new medication. Even if a refill, I'm telling you that consider it as it's a first time. And as long as it's if it's only counseling, that's fine. No doubt that you took the 100%. But as long as it doesn't tell you that there is no DTP, that means there is a DTP, And here, this DTP is you can lose a patient. That's you put the patient life in jeopardy, So it's a big thing that you cannot mention something like this. Even if like you do not assume, even if you tell me in one like sentence, and by the way, I know you're taking Viagra, please don't take them together. That's it. That's it.
Okay. I asked you about blood pressure, but I didn't address
that. I know.
Yeah.
I frankly speaking, I thought you're gonna pick it up because you asking about every single medication. I thought that you're gonna do it, but you didn't even mention at the beginning. And you asked about the blood pressure. I told you my blood pressure is fine.
Yeah.
Maybe it's fine today because I didn't take them together today. It's not gonna be that situation in when you give me the new medication. I don't know, right?
Okay.
So we have to address that. But you went through the question, like the sorry, the medications one by one. It was very good. So I thought you were going to, you know, to
Yeah.
find it. But
Yeah,
it's okay.
thanks. Thank you.
But you got my point at the end.
Yeah, I got. I think we should address that too. Even though it's filmed 15 days ago, but we have to address that when you are taking. We have to tell the patient not to take.
And he's taking telmisartan as well, you know. So it's a. There are 3 medications. If you combine together, maybe a severe hypotension may happen, right?
Exactly. Yes.
So yes.
Thank
So
Okay,
consider all.
so yeah,
Thank
is it clear, guys? Okay, till now we have 2 stations. We will revise on the competencies at the end of the session, okay, with these 2 stations. So I think the assessment is clear, okay, and the DTB is obvious now to everyone. Let's go. 3rd station.
So here the solution. So we can recommend the same medication that the patient has to take before. Yes.
You can recommend whatever you need.
Yani, or
Tamsulosin is good. He will dizziness was the main problem. Take it at night, no problem. Okay. So I told you it's a very small, minute like dizziness, but don't take them together. Don't take the Viagra with the telmisartan and the Tamsulosin all together. That's for the
okay.
safety. That's it. Yeah, it should be simple. Yeah.
Thank you.
So station number 3. Okay. Would you like to do it, Gazouly?
اخش انا ماشي. خلي نهى سوري نهى رفعت ايديها سوري.
هاي
نهى يلا يا محمد خش.
ما شاء الله الريفرنس 46 pages.
لا بص ده هابس انا ممكن ما تحتاجهوش اصلا تبص
yeah I know.
This station is not like a reference station, شباب. Okay. It's not an easy one, honestly speaking. It's not an easy one, but it's like you can solve it easily. You can solve it easily. Yeah. Just be focused and you will do it.
يلا مستر محمد حسن.
مستر محمد حسن انت معنا محمد. طيب
موجود.
نمت انت يا باشا. انت فين مقيم فين؟ Where are you
أنا
located?
في I'm at Saint Jean.
دي نوفا سكوشيا دي ولا ايه؟
NB.
ها؟
NB. Brunswick.
NB نيو برونزويك؟ ده الجزء الفرنساوي ده ولا ايه؟
لا أبدا بريطانيا عندي فقط.
الجزء الانجليزي عادي؟ طيب ربنا معاك يا باشا. اخبار السمك عندكم ايه؟
بيبلبط.
عندكم سمك كتير صح؟
كده الستيشن راحت في داهية والناس زمانهم بيقولوا ايه بالعربي.
بيبلبط يا عم. ماشي يلا بينا. اوكي تايم يا باشا. who's the candidate?
ايه
your name is نهى. Yes نهى. بنت بلادي ولا ايه؟
انا سورية.
سورية. بنت عروبتنا. ماشي. يلا يا بنت سوريا. يلا بينا. Okay, you have for this station you may take up to 60 seconds, but I believe 30 seconds would be fine, Mohamed. So please count only 30 seconds. Go ahead, Gazouly, you will be the actor, okay?
انا لا يا عم لا كمل انت بقى خش.
انا ليه انت مش قلت هتدخل؟
لا اعمل انت معلش انا اسف.
Okay guys, go ahead. Yeah, 30 seconds we will start.
Okay. So hi, I'm Nuha, the pharmacist. How can I help you today?
Yes, no, hi. It's I'm a physician here. I'm a family doctor of Mr. Daniel Lamotte. I have like a simple question to you. The guy, Mr. Lamotte, is like suffering from increased heart rate recently, some nervousness, some movement difficulty, and he has difficulty. He has some difficulty in sleeping at night, and
Okay.
he feels tired all the day. Okay, so yeah, he's been taking Concerta for about 3 years now, 3 or
Okay.
4 years. Last year we introduced the Intonev. Okay, the Intonev for the text.
Okay.
We developed some text. It was last year, and we introduced that.
Hmm.
I would like to know what the reason of this problem, if you can help me. Is there's like any side effect or something from the medication? That's it. Last
Okay,
thing,
sure.
yeah.
Okay, sure, I will help you. So please be seated in our private counseling area, and everything we'll discuss will be confidential. So
Yes.
as I see, your patient name is Daniel, and his age is 22 years old. Does the patient have any other medical condition than ADHD?
No, he's only ADHD, and I believe that the medication is not like sufficiently effective. He still has some difficulty sleeping, some nervousness. I don't know. It's like signs of.
The concern is about the side effect, but is the ADHD its control? Is his main problem is controlled with the Concerta and Winfacine?
It's supposed to be, but recently, as I told you, he's nervous.
He's nervous. Okay. Does the patient take any other medication other than those two medication, three medication?
No.
Any OTC medication, herbal supplement, or vitamin?
Herbal supplement, vitamin? No.
No. Any allergy? Any new allergy declared newly?
No.
Environment or on the medication or on the environment allergy?
No.
No. Okay.
Yeah, he's allergic to pollen. Sorry.
Okay. I want to ask some question about his lifestyle. Does the patient drink alcohol?
No.
Smoke? Does he smoke?
No.
And does he drink any caffeinated beverage?
Don't think so.
What about his diet? Is it good diet? Recently, any change of his diet?
Yes, he's following like a healthy diet since his last surgery. I think he's now is okay with the diet. He's following healthy diet.
Okay. There is any
4 months ago.
Okay. There is any change in his weight recently have been experienced?
Yes, I think.
Okay, so
he's gone through like a bariatric surgery.
Okay. So he lost weight recently.
Yeah, about 40 pounds.
Okay, 40 pounds. And when he did this surgery?
I think 4 or 5 months ago.
Okay, 5 months. So let's go back to your concern. So the concern is about insomnia and some nervousness. Recently have it.
Yep.
Okay. As I see on the profile, he take Concerta. When he takes the Concerta in the morning, every morning he took 18 plus 50.
As usual, yeah.
And Intuni, he took it in the evening.
Yep.
As usual, as prescribed.
Yes.
Okay, so let me check my reference and I will get back to you. There is any other concern you want to check or to ask, please?
No, I just wonder if that is okay. So no, if no, I can prescribe him some like benzo or something for his nervousness.
Okay. Okay, so give me a moment. I will check my reference and I will get back to you.
Go ahead.
Okay, let me check this big reference.
How many minutes, Mom?
Yeah.
How many minutes? Mohamed Hassan.
2 minutes. I was mute. I'm sorry. 2 minutes.
Okay. Okay. As I see in my reference, this medication is weight related, because he lost weight recently. So we have to reduce the dose of Concerta. And I think this problem, the insomnia, is because the high dose of Concerta. So if we try to reduce the dose, so let's say stop the 18 milligram and keep the patient on 50 milligram and check if the insomnia will resolve and the nervousness, because as I see, the dose, it became high for his weight that he reached recently. So, so I think the problem is the high dose of Concerta. If we reduce the dose, the problem will hopefully resolve.
Okay, so you believe this is like a sign of overdose?
Toxicity of Concerta, because he lost 40 pounds recently, means like 18 kilograms. And we have to reduce the dose of Concerta to avoid the toxicity that he experienced recently.
Okay, good. It's okay, time. Very good.
Okay, so thank you, doctor.
Thank you, Bish. Very good. Very good. Very good answer, actually.
Okay.
What made you ask the question of the weight?
Because I'm working in a pharmacy, and we see a lot of this problem happen with the patient who the dose change, so experience some side effects. So, and usually with the young people, especially 7, 8, 9 years, always dose dependent. So that's why.
Very good, very relevant and very practical example.
Okay.
Because it's because of that.
Okay, thank you.
This is a real situation practice, by the way. This is a real situation.
Yeah, we see it a lot.
It happens a lot. Okay. So here with the Concerta, the problem is the weight. Okay, very good. This is from my side, it's completely solved actually. You answer all the questions, you made the assessment very good. You asking the relevant question about the diet, maybe the diet, yes. Maybe the other medications, and the weight, definitely yes, it's the weight. Okay, so yeah, he lost about 40 pounds, around 18 kilograms. It's like a big mass, so definitely it will affect the effectiveness and put the patient at the risk of the toxicity, as you said. And the symptoms here is clear. These are like pure overdosage symptoms related to Concerta. Okay, the nervousness, lack of sleep, the difficulty movement, and everything. It's like overdosage. It's not like a lack of effectiveness. Okay, so make sure, as Noha said, this is like a frequent and repetitive scenario that happens from time to time in the pharmacy practice. Yes, it happens everywhere. Okay, make sure that you are aware of the overdosage symptoms of the stimulant in general, and how to differentiate them between the lack of effectiveness and the overdosage of the stimulant. This is important. This is like a table in the CTC. In the RxTX or the CTC is like a table that explains the overdosage symptoms and the lack of effectiveness symptoms. It's very important. Okay, so you were very systematic. This is very good. You asked it, as I said, relevant question. You answered the concern. You even the second concern, you answer it. Yeah, assessment, counseling, follow-up is very important. The last thing that you missed maybe could be the follow-up. And here, usually with healthcare professionals, I would recommend usually to make like a patient care point or patient care follow-up that you ask the physician, if you would like, doctor, I can follow up with the patient and make sure that after reducing the dose to 45 milligrams, this is the right dose for him, so I can make a follow-up in 1 week or 2 weeks from now. This would be like a bonus mark, like a jackpot.
Okay.
Okay.
Yeah, but because the time is finished, I don't have time to ask about follow-up. That's why.
What? Yeah, I know. You don't have, but as I said, you get.
Yeah, we have to.
This is completely solved one.
Okay.
Completely solved. No doubt about it.
Thank you.
Okay. Very good. That's it. So practice, real pharmacy practice is relevant to the OSCE exam. Okay. Put yourself at the place of the pharmacist.
Okay, Mohamed, there is some questions هنا. بيقول لك is it new increase of the dose of Concerta? I don't think it's a new increase. The point is he lost a lot of weight, so the concentration became so high. بس كده هو ده الموضوع يعني.
ايه سامع ايه معلش.
there is questions. Can you answer the questions in the chat room?
The surgery won't affect the drug absorption. It would be decreased. Yes, so it could be. Yes, why not? But here in the case, it's not the case. This is not the case.
It's not a surgery.
The surgery was since, surgery was since 6 months. So now the patient has like overdosage symptoms, and you have a reason here. You have a reason to worry about, which is the weight. Okay. This is the first one. Here we have surgery.
Please, where can we find this information in the reference?
CTC. Yeah, and here you can find the overdosage symptoms in the monograph.
Yeah, I see overdosage symptom, but I don't see how to manage the overdosage symptom.
So yeah, it would be in the CTC.
But there's no reference about CTC here.
Check the reference. 2 references provided. Station 3.
It will be
factor of ADHD. Yeah.
Okay, so you didn't
if you are practicing in a pharmacy for you, that's why I told Noha before the station that you may not need to go to the reference.
Okay.
And luckily she was practicing in a pharmacy and she knows the scenario. Okay. She spoiled the station, but she solved it, but it's okay. Yeah, go ahead.
It will be stop and retitrate. Like if he is at 72 now, he will have to stop, or his physician will ask him to stop and then retitrate.
Yes, this would be like a tactic, no problem. But this usually we follow this technique with the first days of treatment. Okay,
it's for the overdose.
Yeah, first days of treatment, overdosage with first days of treatment. Like if a patient should start with like 27 milligrams, the doctor started him in 45 milligrams. For example, I given an example. In this case, you have stop and retitrate once again. But here, the scenario is the patient's taking the medication for a long while, for 6 months. Okay, so here you can manipulate the dose. You can manipulate. The patient is dependent on Concerta. If you stopped him abruptly with 72 or 72 milligrams, it's like a high dose. You cannot stop like that. You get it? So it's like he's dependent on the dose. It's been a while. That's 3 years that he's taking Concerta. You cannot stop him like that. You have to stop even when stop this dose. You have to stop like gradually. Okay. You have to tap gradually. Go ahead.
You will remove the 18.
Yes, simply speaking. Yeah. Simply speaking, remove the 18. Try this 45, and then we can see 45 still has the same problem. reduce it once again. Why not? Okay, but for 72 milligrams, he's taken this dose since 3 years, and you would like to stop the dose abruptly. This is not a good technique. Okay, that's why I'm telling you, for this technique, stop and retitrate this while initiating a new dose. When you would like to initiate like a new treatment or something, you can do this technique. With the patient would have been only like few days or few weeks is taking the medication, so it's not dependent on it. You know the problem, the stimulants are dependent born on medication. They cause dependence. This is the problem with the stimulant. Okay, hope this is clear. Okay, any questions? Any other questions? I think we are good to go now, guys. It's about 2.5 hours, and it's almost 11 here in our region. So I think it would be a good reason to to finish the session. Next session will be we shared the table. We shared the. You have the whole table, right? On the MCQ group, on the OSCE group, Telegram group.
Yes, yeah, the schedule, yeah, I think so. Yeah.
Okay. Yes. Session 1, 1st of February. The second session will be the 5th, March 5th. Okay. Mariam, please, what do you want? You have a question? Mariam, can you add me to the Telegram, please? No, I cannot add you. I can share you here, guys, the link if you are not yet on the Telegram. How did you join? How did you join the class, the session? If you are not. One moment. I'm gonna share you here. Yes. This is the link, guys. Link for the OSCE Telegram group. Okay. You can join. Okay. Thank you so much. I have to stop the class.
Thank you يا شباب. Thank you يا محمد، والله انت تعبت معنا في التايمينج.
محمد حسن.
حبيبي، شكرا ليكم انتوا والله.
تسلم.